Hey, YouTube friends. This is Heather Mara, physical therapist, pelvic floor physical therapist, and founder of One Simple Step. One simple step to help you take a step towards health and healing. And I'm passionate about sharing about the pelvic floor. The pelvic floor is an incredible part of our body that often gets ignored until we have a problem. And a lot of things, if going well, can do great because we're talking about poop, pee, and sex. So if we have good pelvic floor health, then everything is functioning well. We're not leaking, we're pooping whenever we need to, and sex is not just pain-free, but it's enjoyable. So, how do we know if we have healthy habits? So today let's talk about bladder health. How are you peeing? Do we talk about it that much or we just do it and we ignore it until there's leakage? So let's talk about three things today that you can check on yourself. One, how frequently are you going to the bathroom? A normal frequency of urination is 6 to 8 times in a 24-hour period. So if you break that down, it's every 2 to 4 hours. Now, if you're like me, I can't think back and remember how many times have we gone today. So I highly recommend writing down on a piece of paper how many times you go in a 24-hour period. And just being aware too, as you walk past the bathroom, are you just walking in because you're walking by the bathroom? Being more intentional about your frequency makes a big, big difference because some women are going very, very frequent. Then a lot of like teachers and nurses aren't going. It's like, oh, I can wait all day. And that's just as unhealthy also because it sets you up for a risk for urinary tract infection because urine's sitting in there way too long. So keep track of that. 6 to 8 times in a 24-hour period, every 2 to 4 hours. Tip number two, is your bladder full? How do you know? There have been times I'm sure you felt the sensation of, oh my goodness, I've got to go to the bathroom right now. You sit down and then just dribble, dribble, dribble. So, a full bladder is typically 10 to 15 seconds. So, you start the flow of urine and you start counting 1 Mississippi, 2 Mississippi, 3 Mississippi. And if you get between 10 and 15, then you know you've got a full bladder. Sometimes you sit down and it's just a few seconds. So, then you know that I could have waited a little bit longer. So, that's tip two, is your bladder full? Tip three, what is the color of your urine? Urine should be a pale yellow, like a Post-it note yellow, not the dark, concentrated brown, smelly, very acidic urine. If it's pale, then that tells you that you're flushing out your system and you're drinking enough water. Again, 8 to 10 cups of water at least. But if you're drinking a lot of the Cokes, Mountain Dews, teas, and coffees, and your water consumption is going down, then your urine's going to be a little bit more acidic. So those are some things to think about when you go to the bathroom is to look at the color and see and congratulate yourself. It's if it's a pale yellow, and if it's darker, just know let's go start pushing some more water because again, you do not want urine that's very acidic because that's more of a bladder irritant and it puts you at more of a risk for incontinence or leakage also. So just be aware of those three tips today and you can improve your bladder health and you know that you've got some good habits for peeing. So again, be sure and subscribe here. Thanks for following, and more tips will come about bladder health, pelvic health, and just taking one simple step towards health and healing.